Welcome back. We are continuing and we're heading into the last segment of today's issue here on ENCA, where we are focusing on that balance that needs to be struck between saving lives and protecting livelihoods as the country is now on day 2 of lockdown level 2. Mr. Pityana, a number of things came up both from Dr. Pillay and Tessa Dooms just before we went to break round about business. From a health perspective, department perspective, I mean, you could hear Dr. Pillay say there are test kits available, and of course, as the economy is opening up, you've pointed out that in the past we saw a spike in infection rates, and this is likely going forward. I'm sure you welcome as business that the fact that you could access those testing kits.
Well, thank you very much, Dan. I must say, first of all, I was quite disturbed to hear from Tessa that the employers that are firing workers because they happen to have tested COVID positive. That must stand condemned, and would like to hear if there are any details on anybody who does that. Would like to take them on as Business Unity South Africa. But also, employers need to understand that that's illegal, because that's an act of discrimination that is prohibited by law. You can't dismiss people from employment simply because they have a health condition. So that's something that we wouldn't want to be associated with as organized business in this country.
Now, beyond condemning such practice wherever, if it exists, as Tessa has pointed out, what is BUSA prepared to do?
We are prepared to take on those members as organized business, and that's why I would be keen to get, if there's any information on this, we would like to hear that. We had interactions and feedback from some of our labor partners in the earlier period of lockdown about some of the malpractices on the part of some employers, some of whom were not members of our organized business, but were able to reach out and make direct interventions to try and correct that. It's important that as society we all work together to defeat this, and that the burden that comes with the challenges of this virus shouldn't be located and be placed disproportionately on the most vulnerable in society. If we do that as a society, then we're kind of different to the values that enjoins us as a nation.
Tessa, is that kind of response sufficient?
Well, it's important that business does take responsibility in this regard and does hold each other accountable. I think the business community must know that if you have people who are not following the rules, people who are doing disingenuous labor practices, that it reflects badly on the entire call that business has to return to economic activity. So I think taking it seriously is important, seeking opportunities to engage with those businesses, and particularly in some of the larger businesses like big retailers and big spaces where often workers can be very easily missed because they're flexible laborers or they're really low-paid wage laborers. And so it's important that we protect the most vulnerable workers in our businesses and in our society, and I'm heartened at the idea that the organizations are willing to take that on.
Well, I guess from BUSA's perspective, I mean, it's unacceptable, and Mr. Pityana saying it's very much illegal, and they are prepared to act on it. But Mr. Pityana, on the health strategy side, what would you as business like to see now going forward? You heard Dr. Pillay saying there are available test kits. While some businesses might have the wherewithal to assist their employees to get tested, they didn't have access to test kits, but that might be different now.
Yeah, I mean, one of the things, Dan, is that, we're talking about business as if a homogeneous entity. There's a disparity in capacity in business. More established and bigger businesses, I can say this about the mining sector, the issues of health and safety have been foremost in the programs of those types of industries. And we have capacity and resources to actually invest in ensuring that we have sanitization and masks and testing and all of that, and isolation capacity. In fact, in the mining industry, some of that excess capacity we share with communities to make sure that, because you can't isolate businesses from communities. And you've seen the same thing happening with the examples in the motor industry and other more established sectors. The bigger focus for health support is, and for all of us to support, is the smaller businesses, the smaller and medium enterprises who may not have similar infrastructure to lay out to assist their employees and to assist members of the public who interact with them. So it's going to be very important that we work together in respect of this, and that's why we think that the collaborative platforms that have been created are ones that we're using optimally.
You're working
we also are concerned that with the emergence of prospects of virus, we need to be production ready as a country. We need to have the capacity to produce to manufacture the medical interventions that may be available with the research that is going on.
Okay, so local production of some of the stuff that is needed. Now, as we're heading towards, we've got another 5 minutes to go before we conclude our discussion. I just want us to focus on how likely is the second wave, and what should we be doing as business, as society generally. I'm going to start with you, Dr. Gray, because we've had the warnings, even from the president the other day, saying that this is not the end, of course, of the pandemic, and people must really still continue to behave the way that the health authorities are urging everybody to behave. But how likely is a second wave now that we've moved into level 2?
I think that all depends upon us. So we're in the endemic phase of this COVID pandemic, where infections will grumble on in the community, and we won't be able to eradicate it unless we have a vaccine. And so we want to be able to contain the spread of COVID-19 in our country in such a way that we don't have a resurgence or a second wave, and so that we can manage the epidemic in our hospitals, and we can make sure that the death rate doesn't go up.
There are some people, I mean, this is anecdotal, some comment I'm hearing that, oh, we're going into summer and it's going to be hot, the virus is going to die.
The virus is not going to die. We didn't die in Europe, it didn't die in America. In fact, it got worse in summer as people went out into the open. And so we have to accept that we have to coexist with this virus. We have to open up businesses, we have to be safe, and we have to accept a low level of transmission and try and control it so it doesn't resurge again. So it's all in our hands. You know, we have to make sure that we don't have a second wave.
Okay, Tessa, you said messaging must change. There's more education. Dr. Gray says it's in our hands to make sure that we don't have a second wave.
Yes, but there's also a role for the state, and a huge role for the state in terms of the management. And something that the NCC spoke about very early on was a differentiated approach to the lockdown, one that takes into consideration provincial, regional, even district levels of both spread and containment, but also the situation that people have in terms of their economic activity, whether or not they have certain setups in terms of density, for instance. And we haven't heard much about those kinds of things as we've progressed. And so I would like to hear more from the NCC about whether a differentiated approach is being considered, whether we're thinking about not just having different messaging for different groups, but considering that an informal settlement sitting in a peri-urban environment is very different from a rural area that has wide open spaces and a suburban area where people have much more choice about whether or not they go to work because they have access to Wi-Fi. And so we have to start thinking about a systemic approach to this that understands the complexities of our country. I think right now we're doing a one-size-fits-all approach to the way we manage that. And in the short term, that might work. But if we're thinking about this being with us for the next year or two while we wait for vaccines to come or not to come, we need to have a much more structured approach to the way we think about this as a government that is flexible and is responsive and is responding to the nuances of our context rather than just taking a one-size-fits-all approach.
Okay, Dr. Pillay, I'll give you an opportunity to respond, but before that, I just want to hear from Mr. Pityana, business's role, what could it be, what could it look like in assisting to prevent a second wave? Mr. Pityana?
Well, we urge more vigilance. This is not over yet. Businesses are very important meeting point for members of society, and we must invest in more education in ensuring that everybody understands that the reopening of the economy doesn't mean that the threat of the virus is behind us, and that the education that we invest in workplaces must be shared with communities, because workplaces cannot be isolated from communities. And as much as possible, we should continue urging people to work from home to the extent that that is possible. Where they have to come to work, we should invest in ensuring that they can do so safely, and that they are not exposed to the virus in a way that they can take it back to communities. We urge also a collaboration between businesses as very important nucleus in communities, to collaborate at a micro level in communities to ensure that we work together to push back the tide of the virus spread.
Thank you very much, Mr. Pityana. Final word for today's issue here on ENC. Dr. Pillay, you've had some of the inputs now. From a government perspective, what would you say the department is going to do to prevent a second wave?
Well, I think the second wave, as Professor Gray mentioned, is not dependent on the virus. It's largely dependent on our behavior. We can prevent a second wave if we implement all of the non-pharmaceutical interventions of wearing masks all the time, sanitization, social distancing, and making sure that we don't congregate in large groups where we can facilitate the spread of the virus. I think that's the key message that I would like to leave listeners with, because I think that's the key issue that can prevent the spread of the second wave.
Thank you very much. That's Dr. Anban Pillay, Deputy Director General of the Department of Health, Mr. Sipho Pityana, President of Business Unity South Africa, Professor Glenda Gray. I heard you being referred as Professor as well. I've been calling you Doctor. Apologies for that. She's, of course, the President of the South African Medical Research Council. And finally, last but not least, social analyst, Ms. Tessa Dooms. It's been a pleasure hearing your views and your insights about how we can balance saving lives and protecting livelihoods while looking ahead as we get into level 2 of lockdown here, we prevent a second wave. Thank you very much for having joined us here this morning on ENC.